Welcome, everyone. We're just waiting for everyone to have the chance to kind of trickle in. I see our number of attendees is climbing a bit, so I don't want to say too much before we allow everyone the chance to sign on. So we'll get started quite shortly here. All right. Well, it looks like that number is kind of tapered off a bit. So I'm going to assume everyone that plans to attend has had the chance to sign in. So we'll go ahead and get started. But please note that this webinar is being recorded. So if at any chance you need to log out before the end, I'll be sending the recording sometime next week so you can listen back at your own time. And yeah, so with that, we'll get started with some introductions. So my name is Hannah Campbell. I'm Senior Assistant Director of Admission here at MCPHS, and I work with the candidates that are applying to our Doctor of Optometry program. And I'm also joined here with one of our faculty members.
Hello, I'm Dr. Kathleen O'Leary. I am obviously faculty member who's been with the school for about 10 years now, and excited to talk to you about the program.
And also by one of our current students.
Hi everyone, my name is Samir. I'm a fourth year optometry student, currently finishing up my last rotation, which is in Syracuse, New York.
Awesome. We are pleased to be here this afternoon to talk to you about all things School of Optometry here at Massachusetts College of Pharmacy and Health Sciences. So during this session, we're going to talk a bit about the university, our program, how you can apply, and we're also going to finish up with a brief Q&A session at the end. So if you happen to have any questions for myself or Dr. O'Leary or Samir, feel free to drop them in the Q&A box on your screen for us to address at the end of the presentation. But hopefully we're able to address everything during today's conversation. So without further ado, let's get started. So I just wanted to start us off with some information about MCPHS specifically. We weren't always Massachusetts College of Pharmacy and Health Sciences. We later added the and Health Sciences part later on, as we were primarily Massachusetts College of Pharmacy in 1823. So we were the oldest institution for higher education in Boston, but we've seen a tremendous amount of growth since then. So nowadays we have 3 physical campuses and a large online branch of program offerings as well. So between all 4 of those areas, there are over 100 programs within different fields of healthcare offered at MCPHS. So you end up working with a bunch of different students from other programs while you're enrolled with us, and you end up learning quite a lot about the healthcare system. And since we've been around for such a long time, we've been able to build and maintain some clinical affiliations with some of the leading medical institutions in the nation. So when it does come time for you to choose your externship sites, you really are going to have no shortage of options to choose from. So talking a bit about our locations a little bit more, we did start in Boston as Massachusetts College of Pharmacy, of course, but these days our Boston campus is our undergraduate campus. Although there are a couple grad programs in like pharmacy and physician assistant studies, we later did expand to Worcester, Massachusetts and Manchester, New Hampshire to be able to accommodate more professional phased graduate programs. Unfortunately, there's only so much real estate in the Longwood medical area of Boston, so we saw these secondary cities in New England as a great opportunity to further expand. So our Worcester and Manchester campuses are strictly professional phased programs that are mostly at the graduate level. So you are working with a very mature environment on campus of more so like young adult learners who are aspiring to their own career in healthcare. And then finally, our online program offerings do include a variety of kind of continuing education degrees and certificates that you can take advantage of, including a Master of Public Health or even an MBA in healthcare business. So talking a bit more about our city, Worcester, that is how you pronounce that word. But if you happen to meet a local around here, you may hear it referred to as Worcester, trading the ER for an AH, as you may find with the Boston accent. So fair warning. And we are only about 45 minutes outside of the city of Boston. That is where you will find Worcester. As the second largest city in New England, there is a lot of healthcare opportunities nearby. Even visible from our front steps is St. Vincent's Hospital, and just down the street from us is UMass Chan Medical School. We do have a great partnership with them because they have an ophthalmology program that we refer a lot of our more complex patient cases to. And we've also collaborated in various research endeavors in the past as well. This is also very much so a college town. So there are 11 other colleges and universities nearby. So I always like to say that MCPHS students tend to stick out a bit. As you can see pictured here, everyone is in their white coats, so you can easily pick us out of a crowd. But we're very lucky to be located specifically in the downtown area of Worcester. So we do border a lot of great event venues and that host various like Broadway shows and concerts and events like monster trucks or professional bull riding or Cirque du Soleil. So there's always something fun happening in this city. We even have two sports teams here, the Worcester Railers hockey team and the Worcester Red Sox. So there's always a season that is offering some sort of free tickets to college students. So you'll get your fair share of free sporting events while you're here too. But I would say 9 times out of 10, if you were to ask any of our current students what they like to do in Worcester, they're probably going to tell you that they like to eat food. So I'm imagining that's what Samir is going to tell me he likes to do or liked to do in Worcester when he was still here as a student, when he had some free time. So why don't you tell us, Samir?
For sure. Honestly, as Hannah mentioned, like Worcester itself has so many different kind of like bakeries, cafes, mom and pop kind of like local restaurants that are unique to Worcester. So definitely do try them out if you do end up coming here. You'll find a McDonald's, Burger King, Dunkin', anywhere, but there's like local cafes like Crust Bakery, which is kind of across the main school building. Even within the city itself, you can kind of explore. There are a lot of different parks. There's a bunch of few lakes. If you have a car or you can use a car with anybody, we kind of like explored around. There are different hiking mountains within the area. Or you can always take the local commuter train line to downtown Boston, which does take about an hour and a half by train, or 45 minutes, which is pretty much what we kind of did when I was on campus with my friends throughout the last like 3.5 years.
Absolutely. We are very lucky to have some pretty good public transportation here. And we're also centrally located into the state of Massachusetts. So there's a lot of direct highways in and out of the city. So it's very easy to hop on the highway and get to the coast or the lakes or mountain region of New England. There's definitely a lot of great things to see around here. But locally here in Worcester, we not only have the commuter rail, but also a bus system, and it is free to use our city bus, which is really nice. So a lot of students do choose to bring a car to our campus, but it is possible, Samir has kind of proven that to us, to get by without a car and utilizing public transportation or whatnot to get in and around the city. So I did say that we can guarantee, or a lot of students bring a car to campus because we can guarantee parking and we can also guarantee housing. So this is something that's quite unique to more of a graduate level campus, given that, you know, there is a lot of adult learners who attend our campus that come from all over the country and some even internationally. So it's nice to be able to provide them some place to land. So with that, we have 5 different residential options for students to choose from that range from studios all the way through multi-bedroom apartments. So with that, the most convenient location where a lot of our optometry students choose to live is Lincoln Square, which was previously a hotel. So you can actually just roll out of bed and head to class because it's all in the same building and everyone gets their own room and bathroom, but there is a shared community kitchen. In addition to that, there are other options that are within like a 10 to 15-minute walking distance from where the optometry program takes place. But it is super convenient given that you are in close proximity, and also all utilities are included in the cost of rent and everything does come furnished. Now, Samir, would you mind telling us a little bit about what your experience has been like living on campus?
For sure. So when I was on campus and like last 3.5 years, I lived at the 10 Lincoln building, which is where most of your classes, labs, and the on-site clinic is, as Hannah mentioned. It was convenient for me because I was able to have my own room, my own bathroom, and then I was able to kind of live in the same building where all my classes and labs and clinics were. I am from Canada, so I'm kind of used to the snow. However, I didn't want to deal with the snow in optometry school. Um, as an optometry student, we're kind of known to have so much equipment. So I kind of wanted to avoid lugging all the equipment in the snow or the rain. It is convenient in that sense where you can kind of quickly dress up in the morning, get ready for class. However, the limitations is that you are sharing a community kitchen with all the Lincoln residents on the ninth floor. So if you are interested in having your own independence and being able to cook, 10 Lincoln Square may or may not be a great option for you, but there are other options within the Worcester MCPHS community that offer different amenities for people who are looking to cook as well.
Absolutely. All of their residences have access to their own kitchen within the unit. Lincoln Square is the only one that just has the shared community kitchen. But the benefit of it is that you're nice and local and don't even have to go outside if you don't want to get to class. Okay, so this is a snapshot of all the different programs that we offer here on our Worcester campus. So there is a total of 9 professional phased programs here. Of course, there are variations of it, such as like our acupuncture programs. You can do different additives, but for the most part, there's 9 different academic areas that students may be pursuing when they attend here. So this is just a snapshot of our community here. With us being a healthcare specific university, we do have our advantages. So you are going to have the opportunity to come together and collaborate with these students on a semesterly basis at the minimum through what we call interprofessional education, or IPE for short. So once a semester, students will participate in an IPE activity where they get to engage with students in all the other programs that we offer here. It's a really great way for you to understand how all these other healthcare professions work, also how to work with patients from different cultures and backgrounds, and ultimately how to work as a team once you're employed in the healthcare system. Now, this is really the university's take on alleviating the current state of the healthcare system for future generations of healthcare professionals, because in the US, it's often described as fragmented or uncoordinated. So our goal is really to graduate students that are better equipped to collaborate interdisciplinary with each other. So, for example, if you're working with a patient who's dealing with a major medical complication, you're probably going to be working with a team of professionals. So that's something that we really try to instill at the student level. So some examples of what we've done in the past have included an emergency medicine Narcan training. We've also done a dementia simulation and a diabetes maintenance training, all sort of centered around the idea that no matter what profession you're a part of, you're going to encounter patients from these populations. So patients who have maybe struggled with addiction or who have dementia or who have diabetes. So this really just allows you to better understand, from your scope of practice, how you best can support these patients, and also how your colleagues from other areas are also able to intervene to provide support. So in addition to that, there's going to be other opportunities where you'll get to collaborate with different professions more one-on-one. In fact, we do a collaboration with our PA students quite regularly. Well, every cohort will, where they will teach you signs of traumatic brain injury and concussion. And then in exchange, you will teach them how to use a slit lamp. So there's something to be learned from everyone. And it is important to be able to identify those signs of concussion or traumatic brain injury just because you work so closely with the head. So it is nice to have that skill in your back pocket. Additionally, we do have active clinics here on campus. So on that list in the previous slide, we have a physical therapy. They have a physical therapy clinic. Our dental hygiene program has a dental hygiene clinic, and we also have an acupuncture clinic. These all actively serve members of our community. So it is really nice to give back to those in need and also hone in on your own healthcare skills within your own clinic, and also support, your fellow student body. So it's going to be quite often where you might have a dental hygiene student approach you and offer to clean your teeth. So fair warning, they are very friendly. And Samir, I'm wondering if you might be able to tell us a little bit about any experiences that you've had with IPE or collaborating with other professions while you've been a student with us.
For sure. So initially, like in our first year, we're the more IPE events tend to be more common. We had an opioid crisis kind of training. As an optometrist, you wouldn't really expect to kind of be involved in that sense, but we are kind of grouped with students in pharmacy, nursing, dental hygiene, I think acupuncture, and we all kind of like contributed to how much like certain conditions and certain medications and I guess opioids can affect the eye and the head and the brain. So it all kind of shows the interconnectedness with the different healthcare professions. Throughout my later time with optometry school, even currently on fourth year rotations, we are actively working with patients who have so many complex medical conditions that you don't like can affect their eyes. Even today, for example, we had to work with a patient's primary care and neurology and their vascular team to initiate a stroke workup intervention because we were seeing stroke-like conditions within their eyes. And these patients are so grateful that we're kind of intervening as like a holistic approach, working on their eyes, but also keeping their primary care and other specialty teams in the loop, and they genuinely feel very grateful that they're looking after really well, which kind of reinforces how the IPE events, particularly at MCPHS, can be used in a real world example as well.
That's awesome. I'm glad to hear you're actually witnessing it firsthand out there in the field. Who would have known we'd be trying to prepare you for something, right? um, that's great. Thank you for sharing. So next, we're going to finally dive into the Doctor of Optometry program in a bit more detail. So just kind of starting with some basic information. We do launch a cohort once a year, every fall, particularly every September. And this is a 4-year program. We do really pride ourselves in having some small class sizes. So our faculty are able to provide you with a lot of individualized support. So our cohorts are traditionally around 64 students each year. We do really like that number because it breaks down smoothly into 16 students per lab. And when you are in lab, you are going to be with multiple faculty members, usually 2 to 3. So our lab settings are very hands-on. And you're really not just another name on a roster here. Our faculty really do go above and beyond to get to know you for, who you are, where you come from, what you're looking to achieve. I've heard several faculty members describe us as family oriented, and I can't emulate that enough. So hopefully you'll come and visit us in the future to see for yourself. But moving back to this program specifically, we do have a unique opportunity for you to pursue a buy one, get one deal for a Master of Public Health. It's a dual degree option that you'll complete simultaneously as an optometry student. And it just adds one additional online course to your curriculum per semester. It won't start until the 3rd semester of the program, so our students do get adequate time to get settled into the curriculum before they decide to tack on that extra course. But it definitely is a great degree to pursue, especially if you're looking to potentially go into education or access and advocacy. And I'd also like to point out the stats on the bottom of the screen there, just regarding our residency match rate. We have been consistently above the national average regarding our match rate to optometric residency. So that's ultimately what a lot of these residency programs is looking for, is strong clinicians. And that's what we've been able to sort of emulate with our extremely comprehensive clinical education that will kind of take you through year by year shortly. But ultimately, if you are looking to pursue residency, we have been well equipped to get students set up with them. As Samir can attest to, he recently matched with his residency. So congratulations to him. We're excited to hear how that goes. But before we talk more about residency, let's go through a year-to-year kind of breakdown of what students can expect from the program. So Samir, I hope you don't mind that I ask you to take us through years 1 through 4, given your experience in the program, having been through almost all 4 years at this point. So why don't you kick us off with first year? What can students expect to encounter as a first-year student?
For sure. So initially, as we are going to be a healthcare provider, it's great that the school's curriculum in first year starts off with the basics and the foundations, optics, anatomy, ocular anatomy, just so you have a good clinical understanding, like what's going on, what to expect. And as I did mention earlier, we are treating the patient as a whole. So it's good to have a great basic science understanding of like what else goes on other than the eyes. Something new that the school did start recently is our Jumpstart program. The Jumpstart program allows first-year students to kind of get to know their studying habits kind of early on, so to kind of develop the strong studying habits to prepare for different tests, midterms, exams, because optometry school is a lot and it can be kind of difficult to getting adjust to like how to study for like an optics class versus an anatomy class. So this program, from what I heard, has been very successful, and many students have appreciated the work that our professors have incorporated into this new program. In addition to that, you're actually learning more of the basic skills that are needed to do an eye exam. So you're mainly more in lab. You also do have opportunities to kind of observe patient care. One of the assignments in your first year tends to be sitting as a patient, getting a full comprehensive eye examination done on yourself, and kind of seeing how like the regular flow is that is of an eye exam performed by a student in either a second year or a third year on you. Biggest thing with MCPHS, it's students themselves performing the eye exams under supervision under a licensed doctor. So you do kind of get the whole experience and from the start to the end of the eye exam and seeing how much patient student experience kind of develops as it kind of progress through the program. Um, that's mainly first year. You kind of develop more of the basic clinical science skills, the basic eye exam skills. Moving into second year, in your fall semester, you start seeing patients on your own. So you're kind of scheduled within the clinic for scheduled one patient per week. You kind of get 4-ish hours to do the full exam from start to end under supervision of a licensed doctor, or maybe a third year or a fourth year. Biggest thing is kind of getting your hands wet, kind of starting the eye exam, seeing how it feels, working on a stranger patient who is not a classmate or another student. Um, it does kind of it seems kind of nerve-wracking, but at the end of the day, the MCPHS provides an early clinical experience, so we have a great foundation as we further develop within the program. Alongside that, you're also rotating within the local Worcester public schools. We have different programs that are available for local public schools from kindergarten to grade 12, where we're doing vision screenings. If on those vision screenings, these students who are performing the screenings notice something like a complaint by a student, an abnormal finding, these students are then referred to the MCPHS Eye and Vision Center, and they are given an eye exam and a pair of glasses at no cost without any questions of insurance. As you will probably see, the early childhood phases tend to be very crucial in getting their eyes checked and making sure they're developing well so they get to live a great quality of life. Alongside that, you're also working within the 10 optical setting, working with our opticians and then helping like live patients selling glasses, working with insurances, because you never know where life will take you after graduation. You may decide to open up your own business, have the optical side. So it's great experience the school does offer having a rotation within the optical as well. I guess moving forward with third year. So in third year, you're kind of continuing on seeing patients. However, it kind of splits off. You're sent to different community healthcare centers within the greater Worcester area. We have 3 different sites. There's one in Worcester, about 10-ish minutes from our school, and then a Framingham location and a Milford location, probably about 45-minute drive from the Worcester, from 10 Lincoln Square. At those community health centers, you're seeing a very diverse patient population whose primary language may not be English. So you are ideally using an interpreter or an on-site translator to kind of work around the language barrier and providing the comprehensive eye care to those patients. These patients tend to have very unique ocular conditions that you will be taught in school and you may not expect to see them. However, you are seeing a very specific patient population and you're kind of giving them the true and basic eye exam to help them with whatever condition they may present with. Alongside that, within the school, you're then exposed to our specialty clinics. We have specialty clinics ranging from pediatrics, binocular vision, low vision, glaucoma, and contact lenses. Within those specialty clinics, you're kind of exposed to different types of pathologies, working with children, people who have loss of vision, different ocular diseases, and it kind of gives you a good range of like clinical experience because once you move forward from third year, you kind of have a good understanding under your belt. Alongside that, within third year, we did start a national boards part one kind of boards review course. I think my class, so 2 years ago, we were the first class who started it. And then from there, the school kind of realized that this was successful, which was evident with the first time part one passing rates of my class, which nearly almost like doubled or tripled from previous classes. So it has been successful in that sense, and it has been moving forward with the classes below me. And hopefully, we kind of see the same successes as we saw with my class. I guess moving forward then with fourth year, so where I am in right now, kind of nearing the end of it. So fourth year will initially start with kind of 3 16-week or 4 month externship rotations, either within the Worcesterish area or across the country. We have locations as far out as in Alaska, Texas, California, Florida, or within the New England kind of region. Initially, you kind of have few different expectations. You're rotating within a community health center, working with the very, I guess, like lower socioeconomic status populations, providing them eye exams. You're also expected to be at a veterans affairs facility, working with the veteran populations who may have a different, I guess, like aspect with like diseases that are found within those populations, and then an elective choice. So I was at a health center, and then my last one was a VA facility, and I'm at another VA facility as my elective. Alongside your rotations, you are working on a capstone course, which kind of is a year-long course. You submit few patient cases, and then ultimately you will choose one of those cases to present at a grand round setting to the school, presented to all faculty, classmates, which happens near the end of your fourth year. So for my class, we're about to start them next week. In addition to all of that, there are a few other things ongoing. You are kind of preparing for national boards parts 2 and 3. Part two is more case-based patient management and treatment of conditions. And then part three is where we all kind of have to fly down to Charlotte, North Carolina, and perform different eye exam skills and also work with different patients on different clinical settings. With that being said, our school does have a part three room, which offers the same eye examination equipment that is seen in Charlotte, North Carolina. So the school is building and kind of allowing us students to have access to these resources. So we're the most prepared to do the eye examination skills in Charlotte, North Carolina. Lastly, as Hannah did mention, there is the residency application that is on kind of starting in fourth year. Residencies aren't required for optometry students or optometrists, I guess, but it is optional. Many people choose to do ocular disease, cornea, pediatrics, or even general primary care, but it is on kind of ongoing optional. You're told a 1 year's residency gives you 5 years worth of experience. I chose to do one and I matched up my top choice because I want to have the experience in seeing more ocular disease within the 1 year. Other than that, I think that kind of lets off with the end of fourth year with graduation at the end.
Thank you so much, Samir. That was a very detailed breakdown. We appreciate that. Looking forward to hearing how everything goes with your upcoming residency. So we wanted to shift gears a little bit here and talk more about our facilities that we have here on campus. So I figured who better than Dr. O'Leary, who has called this, I suppose, home for the last 10 or so years. So Dr. O'Leary, would you be able to tell us a bit about the spaces that we have for students here at MCPHS?
Yeah, so starting off, just the picture of the door here on this slide is actually the door to the Eye and Vision Center, which is our, again, on-campus clinic. And this is where our second years begin to see patients in primary care. So Monday through Friday, this clinic is I would say pretty busy, whether it's primary care with second years or like Samir also mentioned during third year, our third year students are rotating through the different specialty clinics. But it's totally a mix of patients from either colleges in the area or staff or faculty at MCPHS. But again, it's a lot of just local residents in the Worcester area as well coming in who may be getting referred into the specialty clinic. So this is a place you become, as Samir can attest, very familiar with throughout your time at MCPHS. And all the exam rooms in the clinic either have teaching tubes so that if you're examining the front part of the eye, a teacher can actually look in to see what you're looking at, or vice versa. If the doctor is looking at something, the student can look in the teaching tube. Or if we don't have teaching tubes, all of them also have video monitoring. So you'll able to see what the student is seeing on a computer screen. So that's really nice piece of technology that we have. And I will say the school in general is really great about buying the kind of latest and greatest technology for each of the specialty clinics. So it's something that you'll be exposed to during your time on campus, which will be helpful when you go out onto your externship rotations to have been exposed to the different pieces of technology. One other thing that's listed on here too is we do have essentially simulation units for looking at the back of the eye. It's called VR Magic is what we call it, but it's essentially like virtual reality to look at the back part of the eye. And it's definitely a cool tool to use to help kind of enhance your skills before, again, you go out on rotations and start seeing a lot more patients. And then, like Samir mentioned as well, yes, this is your on-campus clinic, but we are affiliated with 3 community health centers. So during the time, we try to have students rotate through those community health centers as a third year. Just working with different preceptors, working with different patient populations is important to rotate through those different community health centers.
Thank you so much, Dr. O'Leary.
Yeah.
Another important piece to note is that we have some research opportunities that are available to students for those that do want to get involved in research at least. So a lot of our faculty members are still participating in research to some extent. So if you do want to get involved, you can get paired with them on their research, or you can even design and perform your own research endeavor with a faculty mentor. We do have university funding available for those that do want to participate in research, and we are big advocates for you to present it at local and national conferences and such. And we've looked at really all sorts of different aspects of eye and vision care, including like ophthalmic device technologies, drug studies, optics, public health, virtual reality even, sometimes involving internal MCPHS programs such as pharmacy or even occupational therapy, as well as external partners, including our friends over at UMass Chan Medical School and even Massachusetts Eye and Ear, which is a really big research institution in Boston. Now, Dr. O'Leary, I'm wondering if you can kind of share about some of the different research opportunities that we have partaken in the past.
So I'll talk really briefly about one that I did, which is in the first picture on the left-hand side. This is essentially a VR system, but really what the patient's doing is they're reading essentially a small little story or paragraph. And what the device is actually doing is looking where their eyes are pointing. So it's using essentially infrared sensors to track where the patient's eyes are pointing. And like I mentioned, I work with pediatric patients. So obviously looking at reading eye movements is really important for vision and learning. So this was a new device that came on the market, and we were essentially comparing it to a tried and true device that we've used for many years to seeing if they're comparable. So that's something that we did more recently. In the kind of third picture over, this is actually I should say that's Dr. DeLiso, our low vision faculty, but she is doing a study currently right now with one of our students, and they're essentially looking at a new lens to help patients that have lost side vision on one eye. And the way that they're trying to see if the lens is successful is by using essentially this computer screen to see how quickly a patient reacts to essentially a stimuli coming in from their side of vision that they've lost, and seeing if the new lens makes a difference or not in enhancing that patient's vision that they have left. So that's really cool. That's ongoing right now. And they're doing that in collaboration with other sites like UMass in the area, and I believe Harvard as well too. So definitely exciting.
Absolutely. Definitely a lot of ways to get involved if that's up your alley. But hopefully all this sounds really exciting to you and you can picture yourself here in Worcester with us. So let's talk about how you can get your application going. So first of all, everyone that is looking to apply to optometry school is going to need to utilize the OptumCAS application here. It is a centralized application system that will kind of compound all these different application requirements and send it off to all the schools that you're looking to apply to just in one go. So it is very centralized, makes it a very easy process for you. We do prefer that everyone applying to this program has a bachelor's degree, but there is some instances where we'll consider those with at least 90 college credits for admission into the program. And they just need to have at least 90 credits by the time that they start the program. So some might be like still in their junior year and just under that 90 credit limit when they apply. But as long as they have at least 90 credits when they apply, they don't necessarily have to have a bachelor's degree, but it is preferred to have a bachelor's degree, of course. And then you're going to need to send in all of your college transcripts into OptumCAS. So even if you did just one random course at a community college one summer, we are still going to need to see that transcript. We look for a minimum GPA of a 3.0. That's more recommended. We have definitely had applicants apply with scores or GPAs slightly lower than a 3.0, but we do prefer a 3.0 and above. And we also require a test score. So primarily candidates will submit an OAT score, which is the optometry admissions test. We do also consider the GRE in addition to the DAT and the MCAT. So those are other scores that we will consider. Regardless, these scores should be around the 50th percentile range, preferably the 50th percentile range and above is what we like to see on those scores. Now, shadowing experience for the optometry program is recommended. I always like to use the analogy that if you're going to, buy a car, you want to test drive it. Same goes with your career here. We want to make sure that you understand the roles and responsibilities of an optometrist, and you can really find your passion for becoming an optometrist through the different things that you've observed while either shadowing or working as a tech or an assistant in that clinical setting. So I do definitely encourage you to consider looking into those options. A lot of the times your career services team at your undergraduate institution may be able to help put you in touch with local optometrists or whatnot to complete some shadowing opportunities. So if you haven't gotten any shadowing, that would be my pro tip for you. Applicants are also able to still apply to the program if they have a couple of prerequisite courses in progress. Just note that if you are applying with courses outstanding, we do need them by August 15th before you start the program. And a complete list of our required prerequisites is on our program page. We require things like biology 1 and 2, microbiology, chemistry 1 and 2, organic chemistry, physics 1 and 2, all of these with labs, in addition to calculus, statistics, 2 English courses, and psychology. So just name them off the top of my head for you. So hopefully you got those planned or have completed them already. We also require 1 letter of recommendation, but we do prefer 2 to 3. And these should be professional in nature. So if coming from an academic realm, maybe a academic advisor or a professor that has taught you. We also like to see them from like a former supervisor or manager that can really speak to your work ethic. And additionally, if you have shadowed an optometrist or have worked alongside of an optometrist, this is also a great person to appoint for a letter of recommendation. Now, if you have completed any international coursework outside of, say, study abroad, we will ask for a WES evaluation, which is World Education Services. and they'll essentially translate your international transcript into a US equivalency. This is not needed if you completed a degree or coursework at an English-speaking Canadian institution, but if your institution was primarily French-speaking in Canada, and your courses were taught in French, we will ultimately need this evaluation as well. And if you meet our minimum requirements, we typically will invite you to an interview. We do have interviews both in person and virtual. We are still currently conducting interviews for our fall of 2025 start term. Seats are limited at this point. And in fact, we actually just extended our deadline slightly. So our deadline is May 22nd. So that gives you about a month and a half to get that application finished up at this point. We will also consider new OAT scores until June 1st. So if you are, thinking about applying, but not sure if you can meet our deadlines, we still will have a couple of months for you to get everything in line here and submitted to be considered for the fall. But at this point, it is, just based on program availability. So the sooner you submit an application, the better, just because we are rolling applications. So as we receive applications, we are reviewing them and offering spots in the program. So it is getting to be a bit tight. So to be considered, make sure you are applying as soon as possible. And what currently, really determines a competitive application really comes down to a lot of the times your GPAs, because this is a rigorous doctoral program that's 4 years long. So we want to make sure that you have a proven track record of doing well academically, particularly in your science courses. So for that reason, we are going to review both your cumulative GPA and your prerequisite GPA. In addition to that, we also are going to review your test scores. These are a really good way to show like the current performance you have had in a lot of the different subject matter that our prerequisites relate to. So that's also important. But in addition to that, we want to see that you have a proven interest and motivation to become an optometrist, as you can relate to us through your personal statement, the supplemental questions, and your experience that you've logged. So don't take that for granted. That definitely matters as part of your application. So let us know a little bit about you. Use those supplemental questions to really put in some thought, do some research, and make sure that you're showcasing yourself in the best light. In terms of financial aid, all domestic students are eligible to apply to the FAFSA. I did list our school code there, but I don't expect you to memorize that at this point. So if you do want to Google it in the future, just know it's the same for all MCPHS campuses. And we do have our tuition and fees posted on our website. So if you wanted to look into this more closely, just a quick Google search of MCPHS tuition and fees will give you the most up-to-date information there. And everyone who does apply to this program is awarded some type of merit scholarship that could be up to $12,000 a year. This is really dependent on not only merit, but also your GPA typically. So rest assured that, you might be given something for your application if you're admitted into the program. We do try our best to support our students. I know that going to graduate school is a really big decision, so at least we are able to offer you a little something to help you out. In addition to that, we have affordability appointments that are available through our student financial services team. So should you wish to discuss how you can best finance your education, we have some really great resources available for you to sit down with a counselor to discuss, if you're looking to do Grad Plus loans or finance your education privately, they can certainly assist you with getting that all in line. All right, so we look forward to hopefully seeing you here on campus in the future. I'm going to copy and paste these links into the chat in case anyone wants to take us up on a visit opportunity, as we do have campus tours quite regularly. Usually like once a week, we have a tour going, mostly on weekdays, but there are some dates that you can partake in on like the occasional Saturday. So if Saturdays work better for your schedule, feel free to schedule a date with us then. We have a virtual tour for now as well. I wouldn't say it's super comprehensive regarding the School of Optometry, but at least you can click around and get an idea for how our campus is sort of laid out. And our YouTube channels are also a great option for getting some additional content about our School of Optometry. There are some really great videos in the MCPHS admissions YouTube channel regarding a Q&A with some of our current students and another one with our faculty members. So if you're looking to hear more from their perspective, I would definitely recommend that you check those out. And I also shared my contact info. So I do work with all candidates that are applying to our optometry program until they matriculate into the program. So if you're preparing an application or even just looking to apply in a year or two, I would be happy to meet with you one-on-one to discuss how you can best strengthen your application moving forward. So do feel free to sign up for a counselor appointment with me. I did leave a link to that in the chat. So I hope to meet with you soon. Now, we will switch things over to starting our Q&A session. So if anyone has any questions for myself, Samir, or Dr. O'Leary, we'll hang out here for a few more minutes to address any questions as they, pop up. So I guess I can start us off while I wait for some questions to come in and just pose a couple softball questions to, I guess, Samir. So Samir, I'm sure you had a couple of options when it came to choosing your educational institution. What made you decide to ultimately attend MCPHS?
So I applied during COVID, so 5 years ago, I guess. And then it was my first interview and it was virtual. However, I did not feel that my interview was very like nerve-wracking. It was super conversational, very welcoming. They kind of asked me a few like typical interview questions, but they really want to get to know me during the interview, which I guess kept my standards up higher when I applied and interviewed at other schools as well. And I felt like it was a great community, kind of family vibe that we were kind of like alluding to throughout our whole time today. And it did manage and like it reached those expectations once I did end up like choosing the school. I didn't tour. I just blindly chose the school because borders were closed, so I was kind of like blindsided. However, it met up all my expectations, like kind of like the whole like community vibes and then like family oriented. Everyone was like getting to know you. And then everyone's there for support, professors, students, operator, anybody is there for like the whole like the greater good for you to become the best clinician. So that's pretty much how I applied, why I applied, and kind of like my full circle moment too.
Thank you. While we wait for a couple more questions to come in, I suppose I can just keep posing some questions to our panel since you guys are all still listening, which is great. Dr. O'Leary, I was hoping you could tell us a little bit more about what your schedule looks like at MCPHS. What are you currently teaching and what sort of classes do you primarily serve?
Yeah, so I'm currently teaching right now binocular vision. I'm kind of in the pediatrics binocular vision realm, but I would just say, every day is a little bit different. Some days I'm literally primarily doing admissions interviews. Next day I might be in lab, next day in clinic, next day in lecture. So it definitely fluctuates. I will say though, the nice thing about MCPHS is not all, but the majority of the faculty that you'll encounter are teaching in class and lab, but also in clinic as well too. So they understand kind of both sides of the didactic work and how it can relate to your patients that you see clinically. So I think that's something that is nice. I think all of our faculty here really enjoy doing a mix of both. Like I said, it's not everybody, but the majority of faculty do that. And again, I think it's to the benefit of the student because we're able to bridge the gap between didactic work and clinical work.
Excellent, thank you. Samir, I know that you're, basically done your student experience here, and you may have some really good advice to offer our, incoming students or students that are in the application process. And I'm wondering if there's anything off the top of your head that you might be able to share.
Biggest thing, kind of be yourself in the application. Honestly, I was always involved, so I wasn't kind of scared of like showing like the different like variety and diversity I had in my involvement. I mean, yes, I was in the pre-optometry club. I'm pretty sure everyone tends to be, but I also kind of had like other kind of aspects within my undergraduate program, working, making my own club. So it kind of does show that you do have other goals in mind. Yes, optometry and being a clinician is what you want, but it does show like the diversity and like your involvement within the community, which kind of leads you to be a great candidate as a student, and then kind of clinically and academically, and I guess socially working with different providers, students, faculty during your time in optometry school. So if you're interested in something, definitely do it. It looks great on you that you're showing diversity and involvement in like something other than like science. Like if you're a dancer, continue dancing or so on.
Absolutely. That is something that we note on the application too, is if you were actively involved in research or you were like a student athlete, that really adds to like, the tenacity that you've had as a student and shows that you were juggling a lot and persevered and still did well. So would emulate that too and encourage you to include all that experience that you've had as it does make you you and make you unique in all those special ways. We did get another question for Samir. This attendee is wondering if you had any optical experience before you applied to MCPHS.
That's actually how I got my interest in optometry school. I worked in an optometry office, optical setting, pretty much for like 5.5 years, from like grade 12 right until the day I flew out to Boston or Worcester. I worked with the opticians, I helped sell glasses and contact lenses, and I also shadowed optometrists, kind of like a tech, working some patients up, doing basic billing and insurance and coding and stuff, which kind of provided me the experience and ultimately choose to do optometry school. So yeah, I did work there in Canada for about 5.5 years.
Awesome. I guess I can pose a question to Dr. O'Leary. Um, Now, I know the scope of practice for optometry can vary between states and even for different countries and such. How does MCPHS prepare students that may be practicing in states outside of Massachusetts where their scope of practice may vary?
Yeah, the biggest way that you'll get exposed to this is during a lab called Advanced Optometric Methods and Theory, which is a lab that you take during your third year spring semester. So this is where you're learning techniques like minor surgical procedures. So Chalazion removal is one that optometrists may do. So you'll learn that in suturing. You'll also learn about laser procedures as well, and you'll get to practice essentially shooting a laser on a fake eyeball. So that's something, again, you'll be exposed to during third year of spring semester. And then you'll have the foundational knowledge to be able to then go on to a state that has that scope of practice, but typically those states will require you to do an additional assessment, but you'll at least have that foundational knowledge.
Yeah, great. Important to note that we do teach the whole scope of practice wherever you're choosing to practice in the US. So even though we don't allow lasers in Massachusetts, we still will prepare you if your state does. All right. Well, it doesn't look like any other questions have come in, so I suppose this is where we will wrap it up. So again, if you happen to have any questions, we're going through the application process, please don't hesitate to contact me. I am more than happy to help. And thank you again to Dr. O'Leary and Samir, who have offered their time this evening to speak with us. Wishing you the best of luck with your residency, Samir. And hope everyone else has a wonderful evening. Thanks again for joining us and best of luck with your application to optometry schools. Take care. Bye.
Bye.